what do these famous actors, singers, and athletes all have in common? Each one enjoys a successful career while living with and managing their diabetes. Diabetes can be a killer and it increases the risk of serious complications. But as you can see, you can live a full and satisfying life with the disability. Hi, I'm Kayla, a sports science major at Wright State University, and today I'm going to explain what diabetes is and then share its characteristics, facts, and statistics. I will also share ways to help manage diabetes through exercise. Let's get started. In very simple terms, diabetes is a disorder of metabolism, the way our bodies use digested food for growth and energy. Diabetes is a killer and is the seventh leading cause of death in the United States. It kills more people every year than breast cancer and AIDS combined. Over 30 million people have diabetes, and only about 23 million of those have been diagnosed. The remaining 7 million does not even realize that they have diabetes. In addition to those large numbers, there are another 84 million adults in the United States that have prediabetes. Unfortunately, diabetes is increasing in the United States and rose by 382% from 1988 to 2014. These are the common symptoms that you should be aware of that may be signs of diabetes. Talk to your doctor if you are concerned you may have diabetes. Urinating often, feeling very thirsty, feeling very hungry even though you are eating, extreme fatigue, blurry vision, cuts and bruises that are slow to heal, weight loss even though you are eating more. This may indicate type 1. Tingling, pain, or numbness in the hands and feet. This may point to type 2 diabetes. So let's look at diabetes in more detail. Diabetes involves problems with the hormone insulin. Insulin is a hormone that helps move sugar or glucose into your body's tissues. Cells use it as fuel. Normally, the pancreas releases insulin to help your body store and use the sugar and fat from the food you eat. Diabetes occurs when one of the following occurs: when the pancreas does not produce any insulin, when the pancreas produces very little insulin, when the body does not respond appropriately to insulin, a condition called insulin resistance. There are three types of diabetes. Type 1, when the pancreas does not produce any insulin, and type 2, when the pancreas does not produce enough insulin or the insulin cannot be processed. In addition, the other type of diabetes is gestational diabetes, which starts when the body is not able to make and use all the insulin it needs for pregnancy. It occurs in about 9% of pregnancies and goes away after birth. This slide summarizes the differences between type 1 and type 2 diabetes. As you can see, type 2 is the more prevalent at 95% of all cases, and type 1 only 5%. Type 1 used to be referred to as juvenile diabetes because it begins in childhood. With type 1, the pancreas is damaged from an autoimmune attack, so the pancreas does not produce any insulin. People with type 1 diabetes are usually normal to underweight and must have insulin injections or pumps to survive. Type 2 generally starts later in life, with most diagnosed after age 40, and is influenced by both genetic and lifestyle choices such as obesity. With type 2, the body doesn't produce enough insulin or the body is unable to use it effectively. Insulin administration may or may not be needed for survival. As we just learned, type 2 diabetes is influenced by a variety of factors such as genetics and lifestyle, such as weight, age, and physical activity. For activity 1, please type this into your web browser and take the diabetes risk assessment. After taking the risk assessment, were you surprised with the results? Do you have a family member who would benefit from taking this test? You could save their life. This video demonstrates 2 points. First, that it is difficult to distinguish a diabetic simply by observation, and second, that people with type 1 diabetes can enjoy physically active lives. The one with type 1 diabetes is the blonde in the middle with the black shirt with the gold lettering is my friend. I remember at this workshop, her mother told her to check her blood sugar because her mom thought she looked like she was dragging a little. She was a little annoyed but checked her blood sugar anyways, and her mom was right. She took a glucose tablet and then rechecked throughout the afternoon. This shows that vigorous physical activity can be part of a diabetic, but it must be carefully monitored. I'm happy to say that she rebounded quickly and never missed a step at this workshop. Diabetes is not managed with diet, exercise, and medication if prescribed by a doctor. There can be complications. Diabetes can take a toll on nearly every organ in your body, including the heart, blood vessels, eyes, kidneys, nerves, gastrointestinal tract, gums, and teeth. Heart disease and blood vessel disease are common problems for people who don't have their diabetes under control. If uncontrolled, the diabetic is more than twice as likely to have a heart attack or stroke. Blood vessel damage or nerve damage may cause foot problems that, in rare cases, lead to amputation. People with diabetes are 10 times more likely to lose a foot or a toe than those without disabilities. Diabetes is leading cause of vision loss for adults between the ages of 20 to 74. Diabetes can lead to glaucoma, cataracts, diabetic retinopathy, which can lead to blindness. Did you know that diabetes is the leading cause of kidney failure in the US? Diabetes can harm your nerves. 70% of people with diabetes have nerve damage. It is often seen as pain and burning or loss of feeling in the feet, known as peripheral neuropathy. It is also damage to the nerves that control inner organs, known as autonomic or diabetic neuropathy. The most important ways to slow the diabetes complications is blood sugar under control, eat right, exercise, lose weight, avoid smoking, and get high blood pressure and high cholesterol treated. So, we just learned that exercise is an important way to help with these diabetes complications. It is a key part in managing diabetes along with proper meal planning and taking medications as prescribed. When the body is active, cells become more sensitive to insulin so it can work more efficiently. The cells also remove glucose from the blood using a mechanism totally separate from insulin during exercise. So, exercising consistently can lower blood glucose and improve A1C. When A1C is lowered through exercise, the body may need fewer diabetes pills or less insulin. Benefits of regular physical activity for diabetes include improves your response to insulin, lowers blood glucose levels, lowers blood pressure and cholesterol levels, controls weight, and reduces risk of developing diabetes complications. While there are not any outward physical characteristics that require special modifications for physical activity, it is very important to remember that diabetes is a serious disability. Blood sugar levels must be checked before, during, and after exercise. People with diabetes should use always the 15-15 rule during exercise. Test your blood sugar 15 minutes prior to exercise and ensure blood sugar is within range before proceeding with exercise. If blood sugar is less than 100, eat 15 grams of carbohydrates and wait 15 minutes and retest. The following foods provide 15 grams of carbohydrate: 3 glucose tablets, half a cup of fruit juice or regular soda, 6 or 7 hard candies, 1 tablespoon of sugar. Once your blood sugar is within range, proceed with exercise, but monitor for fatigue and recheck after about 15 minutes of exercise. After exercise is complete, check the blood sugar again. In addition, since type 2 diabetes patients may be overweight, it is important to ease into exercise and always consult with your doctor prior to beginning any exercise program. The American Diabetes Association recommends the following exercise program: aerobic exercise to help your body use insulin better. It makes your heart and bones strong, relieves stress, improves blood circulation, and reduces your risk for heart disease by lowering blood glucose and blood pressure and improving cholesterol levels. The recommendation is 30 minutes of moderate to vigorous intensity aerobic exercise at least 5 days a week, or a total of 150 minutes per week. Spread out exercise over at least 3 days during the week. Anaerobic exercise, strength training to make your body more sensitive to insulin, can also lower blood glucose. The more muscle you have, the more calories you burn, even when your body is at rest. Which can be especially important for people with type 2 diabetes and that may need to lose weight. The recommendation is strength training at least 2 times per week in addition to aerobic activity. Reminder, always consult with your doctor before beginning an exercise program. The 15-15 rule: always carry a fast-acting carbohydrate food such as glucose tablets when exercising in the event blood sugar drops too low and hypoglycemia symptoms develop during exercise. Before we wrap up, let's test your knowledge on some key points of diabetes. True or false? Diabetes is the result of a poor lifestyle. The answer is false. No, diabetes is not the result of a poor lifestyle. Being overweight is a risk factor for developing the disease, but other risk factors such as family history, ethnicity, and age play a role. True or false? Diabetes is not that serious of a disease. The answer is false. Diabetes is a serious disability. Diabetes causes more deaths a year than breast cancer and AIDS combined. Having diabetes nearly doubles your chance of having a heart attack. True or false? There is no cure for diabetes, but it can be managed with diet, exercise, and medicine if medication is prescribed. The answer is true. Being overweight is a risk factor for developing this disease, but other risk factors such as family history, ethnicity, and age also play a role. Unfortunately, too many people disregard the other risk factors for diabetes and think that weight is the only risk factor for type 2 diabetes. Most overweight people never develop type 2 diabetes, and many people with type 2 diabetes are normal weight or only moderately overweight. The diabetes site posts the unusual fact about diabetes, along with many more on their website. It's surprising how long ago people recognized the disease. Take a minute to read. To close, diabetes can be a killer and have serious complications. Keep a positive attitude and keep your insulin under control. You cannot change your hereditary tendency for diabetes, but you can change your diet and exercise to live a full and successful life with diabetes, just like Tom Hanks. Below are the references I used for this presentation. I hope you learned something and have a good day.